The United Nations General Assembly this week focused its attention to the leading causes of death around the world, non-communicable diseases. Also known as chronic diseases, NDCs consisting mainly of cardiovascular diseases like heart attacks and strokes, cancers, respiratory diseases such as asthma, and diabetes are responsible for 38 million deaths per year.
NCDs have emerged as a leading cause of disability and death globally. They impact productivity and impoverish society due to burgeoning health expenditures.
FAO recognizes that NCDs can push households into poverty and can derail the current efforts made in reducing hunger, poverty, and undernutrition if immediate steps are not taken to control and prevent the risk factors driving up the epidemic.
Our world, with an aging population that increasingly adheres to an unsustainable lifestyle including excessive alcohol use, smoking, and an unhealthy diet, and is experiencing rapid increase of urbanization, has been seeing a sharp increase in NDC-related deaths since the year 2000. Almost 80% of those happen in developing countries, and although NDCs are historically deemed a problem of the elderly, they are now progressively seen across all ages.
Leadership at the highest level is necessary. Health in all policies necessary. Low-income countries face the unique triple burden of NCDs, communicable diseases, and injury.
We give our children education so that they'll be good citizens. And yet, when it comes to an activity that is crucial for our survival, such as eating right, we are unable to teach ourselves and our children how to eat right.
In an effort to scale back the impact of NDCs, the international community is calling for government intervention, especially regulation regarding the 4 identified risk factors: tobacco use, physical inactivity, the harmful use of alcohol, and unhealthy diets.
It's a cause for optimism that NCDs are largely preventable. But effective prevention and control requires reducing risk factors throughout a person's life, beginning at conception. It requires multi-sectoral and whole-of-government approaches to health over a range of policy areas.
I hear the need for investment in human capital, the need to strengthen food systems from production to consumption, the need for multi-purpose action.
HIV and NCDs have many things in common that necessitate a more holistic approach. Both are not merely a health problem, but a development challenge. Both require strong political leadership and commitment, as well as social mobilization and public support. Both are preventable, but when prevention fails, require lifelong care.
Panelists, both from the development community and medical professionals, united on the urgency of the problem and the need to lift NDCs out of obscurity. For if the rapid growth of NDCs is not halted, it will undermine the social and economic impact of the post-2015 development agenda, even before its implementation. This is Shari Naiman, reporting for South South News from the United Nations.